ABC 30 Valley Spotlight is sponsored by Kaweah Health.
TAVR procedure, also known as TAVI, is a minimally invasive procedure for aortic valve replacement. The procedure has evolved from becoming a procedure meant only for people who could not undergo surgery to being available for anybody who needs an aortic valve replacement. We have a heart team here who evaluates every patient. Every patient gets seen by an interventional cardiologist who's trained in TAVR, and also by a heart surgeon who's obviously trained in surgical aortic valve replacement. The preference is to try and do transcatheter valve replacement because the outcomes are as good as surgical aortic valve replacement, and the recovery time is minimal. Most patients go home the next day. And so that's slowly becoming the preferred procedure of choice.
Typically our patients, they've been told for many years that they have a murmur, a heart murmur. Not very specific, but as the years go on, they get short of breath. They'll have some swelling in their feet or their ankles. And typically once they start having symptoms of the shortness of breath and the swelling, it progresses very rapidly. So once it gets to this point, you'd want to go see your primary care physician or your cardiologist and just follow up on that heart murmur that you have.
My heart doctor, Dr. Atiran, discovered the bad valve in my heart. So he sent me to Dr. Gupta, and he was good. He met with us several times, explained everything. We decided to do it. I felt good from the time I came out of the anesthetic. I had no pain whatsoever, total comfort, and it helped me. I feel much better. I needed that valve replacement.
It's a team process. We have cardiothoracic surgeons, interventional cardiologists. We have interventional radiologists on the team, and everyone discusses the patient, whether they're a good candidate or not, any other issues they have going on, and as a team we decide whether this is the best option for the patient.
For a TAVR patient, we always have them scheduled a day before procedure. The best part about it is that they will meet their anesthesiologist that day, so they get familiar with the team who will be with them.
We'll have the procedure in the morning. They'll spend the night, and typically the patient will go home the next day.
They kept me briefed right up to the point when I went under the anesthetic, and it was excellent treatment.
They'll see us in the clinic through the next month. We'll do another evaluation of their heart function, and at that point then they get referred back to their primary cardiologist. The difference between having a TAVR valve and traditional open heart surgery is the recovery time is much quicker. We will have patients that will be back at the gym in 2 to 3 weeks.
If I had a family member, or if it was myself that needed a replacement of an aortic valve, I would definitely recommend my family to come here because I really believe in our program. It
appears to be very successful, and the nurses and everybody in the hospital was real good, treated me fine. I was very happy.
ABC 30 Valley Spotlight is sponsored by Kaweah Health.